Okay, so this morning I'm taking Charlie and Elmo to work with me. Charlie needs to finish his horrendous haircut because we all saw how bad that was on the weekend. And Elmo is due to have his teeth cleaned. So this morning I'm getting their medications ready, and they will have their regular Prozac like they do every morning, but I'm going to give them a couple of extra medications to make it less stressful for them when they're in at work. So one of them is going to be gabapentin. That traditionally is used to stop seizures and for neurogenic pain, but one of the beautiful side effects of it is that it also helps to be an anti-anxiety medication. And the second one that I'll be giving them both is clonidine as well. So basically what it means is that it means I'll be able to use less anesthetic agents for them, and the whole experience will be less stressful for them so that they don't continue to fear coming into work. Let's give these to the dogs. Sit. Charlie, come. Good boys. There you go, Charlie. In. Good boy. Good boy. Elmo. Come on. Ah, Elmo, ready? What do you get? Can you do it? Go. Oh, Elmo. In you go. Good boys. Good boys. Let's take your harnesses off for the car. Oh, Charlie. Good boy, Charlie. Alright, boys. Safely tucked away.
Before we do Elmo's anaesthetic, we're going to collect a blood sample to run a pre-anaesthetic blood test. That will check his liver and kidneys and also his red and white cell counts. You can see that Elmo is a little nervous for his blood test, but overall he copes incredibly well. I know that he won't eat when he's feeling anxious, so whilst I was tempted to offer him peanut butter at this point, I knew he would simply not take it from me. Okay, we got good news for Elmo's blood test results. They're all nice and normal, so I'll just scroll down and I'll show you. So, perfect blood test results, so it's okay for him to have his anaesthetic today. In order to anaesthetise Elmo, I need to put an intravenous catheter in. So here I am clipping up the area and prepping it for the catheter placement. I use some local anaesthetic on the skin and I leave it in contact with the skin for 2 to 3 minutes before I then place the intravenous catheter. So now that his intravenous catheter is placed, I'm able to give him his induction agent. The induction agent is the drug that causes him to go from awake to asleep and under the anaesthetic. Once he is asleep enough, I'm able to place the endotracheal tube down his trachea to control his airways. We will attach the anaesthetic machine to the end of the ET tube, and then that will allow him to be breathing in a combination of oxygen and the anaesthetic gas. If he wasn't breathing in the anaesthetic gas, he wouldn't be able to stay asleep under the anaesthetic because the induction agent will only last about 5 minutes. Now that the ET tube is in place, we tie it in so that it doesn't slip or fall out when we're moving him. And then once he's attached to the anaesthetic machine and we're comfortable that he is going okay under the anaesthetic, we start to attach the monitoring equipment to ensure that his oxygen saturation, his heart rate, respiratory rate and blood pressure are all okay. Alright, these are Elmo's teeth. You can see he's got quite heavy tartar and calculus on his back molars there. Not so much here on his front, but we're going to give them a good scale and polish, and maybe he'll have some dental x-rays today too. Okay, so I've scaled Elmo's teeth on this side, so you're going to see that they look a lot cleaner. Let me just move his very hot pink tongue out of the way. There we go, that's his beautiful clean teeth. Now, what I'm really interested in is the fact that Elmo is actually missing premolar 1 here at the top, and he's also missing it down at the bottom here too. So he may well have been born without those 2 premolars, but what we're going to do is we're going to do some dental x-rays to check that he doesn't have any dentigious cysts hiding underneath the gums.
Oh, look how beautiful that x-ray is! Alright. So proud of myself. Alright, look out guys, you're going to get picked. Look to me. Excellent. X-ray! cuteness of the little legs again.
Who is my person, my lovely person?
I'm gonna boom kill.
When I'm taking the x-rays, it's really important that everybody is standing either behind me or greater than 2 meters away from the x-ray camera, because I don't want them to be exposed to radiation. And you can also see that I'm wearing my personal protective gear, in that I have got a thyroid guard as well as my radiation gown on. I have Nurse Kira developing the x-ray plates, and you can see that I'm flicking through the screen of all the different x-rays that I've taken of Elmo's mouth, and I'm checking to see if there are any dentigious cysts or any other dental disease hiding below the gum lines that I need to address. Every time I take an x-ray, I yell out the word x-ray before I take it, because as you can see, there are loads of people in our clinic. I'm roughly halfway through Elmo's dental, so now it's time to roll over and scale the teeth on the other side. I leave the polishing until after all of the x-rays are finished, because sometimes the prophy paste that we use to polish the teeth can interfere with our x-rays.
So I'm just applying plaque disclosing solution to see if I've managed to get all the tartar and plaque off the teeth. And then after that, I'll be x-raying inside of his mouth as well.
So I used the scaler one last time to remove any bits of plaque that I missed, that I'm now able to see with the plaque disclosing solution. I finished my full set of mouth x-rays by x-raying this side of his mouth too. He was missing premolar 1 on both upper sides and both lower sides of his mouth. The most challenging part about dental x-rays is ensuring you have the plate positioned correctly and you hit that ever elusive bisecting angle. Okay, so these are Elmo's x-rays, and what we're looking for here is we're looking for the missing tooth to see if there's any potential dentigious cyst, and the good news is there isn't. It's his upper molars. I'll just flick through and show you. So again, there would be another tooth there if there was going to be a dentigious cyst hiding there. Let's rotate this round. Okay, again, this is the other side. That's where the tooth is missing, but there's no dentigious cyst, which is great. Same deal with that one. And it's his lower incisors and his lower canines. And now that I've finished scaling and x-raying his teeth, it's time to polish them. I use polishing paste to smooth out any of the small scratches or roughness on the enamel of the tooth. You'll notice that we are rolling Elmo with his legs underneath. The reason we do that is to ensure that no extra water or polishing paste goes down their throat during the anaesthetic. Okay, so Elmo's teeth are all cleaned and polished. I'll just show you what it looks like. So here are his beautiful clean teeth. What a difference a scale and polish has made to Elmo's teeth. Wake up. Wake up, Elmo! There's no deal. And then we have Nurse recovering Elmo. Okay, and Charlie trying to annoy Elmo already. Hey, brother life.